All right, part two of the digestive system is going to incorporate looking at the actual organs from the development of the AC at the very beginning, the mouth, and working our way all the way down the alimentary canal, the GI tract. Now, if we look just particular at the mouth, the first portion of the alimentary canal, its main job is to receive food. And what the main thing we're going to look at here is the amount of teeth that we do have. Now, as we start to develop, we have actually 20 primary teeth. Those are what we consider baby teeth. And as we start to age, they end up getting shed, they get pushed out and or replaced by a number of 32 secondary or adult teeth. Taking a quick peek at our individual mouth, things to note here that we do see, obviously our lip, but this guy in the very back, I don't know if I give a different color, you can see it, this little hangy ball thing, that's what's called the uvula. We're going to see that it actually plays a vital role in the swallowing mechanism, and it's going to be having to cover the nasal pharynx. We'll see why in just a second. In terms of our teeth, again, we have our structures of our molars, our premolars, and then we have our canines and our incisors, the ones up the front. They're going to help to tear off and help them to get into food. Of the teeth, the four different types of teeth that we're going to be seeing, again, the incisors are going to help bite and tear off pieces of meat. The cuspids or the canines are going to be tearing in to actually hold on to the food. You take a look at your cats or your dogs and they look at their teeth. You see the larger canines because their mouth is especially adapted for this. Okay, the premolars, the bicuspids, are going to be used to grind or chew up food, and then finally the molars are going to be there to help grind and chew up food as well. So if we're considered a heterotroph, somebody that only, excuse me, yeah, heterotroph, but of the heterotroph, we were considered an herbivore. We would only be eating plant-based material. We'd just be looking at having those two different types of teeth. Now, in our lips, one of the things that we talked about in the nervous system was the receptor sites that we do have. Receptor sites like thermoreceptors. Our lips have a ton of thermoreceptors to be able to sense temperature. Now, most of us, when we're looking at drinking something hot like hot chocolate or coffee, you might put that up to your lips and to see how hot that is before you actually put it in your mouth. Now, if you don't do that, and you just take a big old swig or a sip of something, then you can all of a sudden get in and burn your oral cavity. You know it's not a great feeling. And you guys have maybe done that before or have had kind of some unfortunate memories of that. Getting down into the palates. Palates are the portions that make the roof of the oral cavity or the mouth. The front part, right behind your teeth, is going to be your hard palate. Now, if you put your tongue and you roll your tongue up to the top part of your mouth, you should be able to feel the hard palate right behind your teeth. And as you roll your tongue back, you can actually feel where it gets a little bit softer. That is your soft palate, the posterior region. And at the end of the posterior region, you have your uvula. And that uvula is again going to be utilized to flip up and cover that nasal passage. We're going over just kind of taking a look at the primary teeth. So this is primary or baby teeth, and as they get pushed down, get kicked out by those secondary teeth. Another quick illustration, just showing you that same type of thing from the incisors, the cuspids, molars, and premolars. Of the tooth, portion that we have actually sticking out of our gums is actually known as our crown, and many of us might have an issue with this guy here, enamel. If you go talk to your dentist, they may talk about having to get some more fluoride treatments to help strengthen that enamel, or you take and you use toothpaste, kind of like Pro Enamel, things that are going to help strengthen that. That is the hard outer portion of your teeth, and if that is thinned or weakened, so if you're looking at if this is thinned here, your teeth are much thinner, you might be very sensitive to different temperature changes, air or not, maybe even different food changes. So if something's very sweet, if you know your teeth kind of hurt after eating something, you might be a sign of just having weaker enamel. Moving your way through, looking at the soft palate, we mentioned again that uvula, which is that hanging ball that sits at the back side of your or the posterior region of the soft cavity, the soft palate. And what its job is to do is to function as a door that closes off the nasal cavity during swallowing. Okay? Its job is to flip up. Now, if you've ever had somebody make you laugh, when you're trying to drink something, or if you had to cough quickly while you're eating or drinking something, sometimes you might know that unfortunately we get a little bit of our drink or maybe even food particles up into the nose or coming out the nose. We know that's not a great feeling, especially if you're having some chocolate milk or Mountain Dew, whatever it is you might have. But again, that uvula is going to flip up and cover that passageway so then that liquid or food particles don't travel up into that cavity. The posterior region of the mouth, there are also some tonsils. Tonsils are going to be there to help us to fight off some immune response, help protect some against infections. So if I'm going to look at our steps of a swallowing mechanism, what we first need to do is remember that we have our soft palate, posterior region of the oral cavity. We're going to have that uvula raised to make sure it closes that nasal pharynx. We want to cover that nasal pharynx so that area cannot have liquid or solid particles moving up there. Hyoid bone, remember the connection point of the tongue. The tongue is elevated and the larynx starts to elevate. The epiglottis is another flap that we're going to see here that again is going to cover over top of that trachea to make sure that we don't have any food going down into the windpipe. And then again, that food is then going to be pushed back into the most distal end of the oral cavity, which is going to get to the point of the most proximal portion of the esophagus, and at that point the peristaltic waves are going to start. And remember, the peristaltic waves are the rhythmic contractions that are going to force food from the mouth to the anus. Here's just taking a quick illustration of that bolus of food that we mentioned in our last unit, where we are starting to chew up our food particles, and as that food particle is starting to be chewed up, we want to elevate the tongue, and the uvula flips up. So as that flips up, the epiglottis also flips down. That food particle has to go down the back portion of the throat and not into the trachea, and as it does so, it continues on its way and starts up peristaltic waves. Diagram that you will be labeling on your test is taking a look at this illustration here, your sagittal cross-section of the face. Not only are you seeing some of your sinuses, and we'll talk about sinuses a little bit later on, that are going to help in reducing the weight of the skull, but also help make pitches in your voice. But what you'll be seeing is that of your nasal cavity, obviously your nose, your nostril, hard palate, soft palate, your uvula, which is this, again, that most posterior region of the soft palate, tongue, hyoid bone, that connection point of that, mandible, tooth, lip, vestibule. Vestibule is that space that's found between the tooth and the lip. Some of the things you will not have to worry about in this is you're not going to be having to worry about labeling the tonsils. Let's go to the palatine tonsil, we'll have to worry about. Lingual tonsil, we'll not have to worry about. And actually, the sphenoidal sinus, we're not going to worry about. The other ones you should be able to go through and label. Now remember, as I mentioned earlier about a pharynx, pharynx really refers to the openings or the area behind the particular region. So we've got a nasopharynx, which is the area behind the nasal cavity. The oropharynx is the area behind the oral cavity. And the laryngopharynx is the area behind the larynx. Now, inside here is where our enlargement you guys might have known as your Adam's apple. So stick out a little bit further. What that is the vocal cords. And as the pressure of the air that's coming up vibrates off those vocal cords, it gives us our sound. All right, taking a quick look at the salivary glands. Their main job is to make that bolus of food, and how it does that is by the secretion of enzymes from the salivary glands and brought into the food particle to start digestion. That is that first part of digestion, which is the chemical part of digestion. One of the primary enzymes that you might want to know is amylase. Amylase is the first enzyme that's going to help break down carbohydrates. So if you've ever done the starch cracker test before, the saltine cracker test, that's the enzyme that you're working with. Other portions working their way down the alimentary canal, we have the pharynx, which we've just mentioned before, the three different portions to that. We have the nasal pharynx, the oral pharynx, and laryngopharynx, the upper region of the throat. From there, our food particles, once emptying, going past the laryngopharynx, is going to enter down into the esophagus. Now, the esophagus job is just a smooth muscle. It's a muscle that we don't control. Remember, involuntary muscle that's going to undergo involuntary reactions known as peristalsis that's going to force the food down into the stomach. Now, at the base of the esophagus, you have this lower esophageal sphincter. Now that lower esophageal sphincter's job is to help close off the ability, the backflow of hydrochloric acid that is going to be developed inside the stomach. In particular, it's made by parietal cells in the stomach. Now, its job in the stomach is to mix with the food particles and to be able to break those particles, whatever food of the bolus of food, now again, remember you're making time, into smaller and smaller pieces. Now, if I actually used to try to draw something out real quick, remember we've got our esophagus, and from there we are going to work our way into the, actually our thoracic cavity. This is going to work into our abdominal cavity. We're going to empty our way down into that of our stomach. Okay, not a very good illustration of it, but you at least get the point of it. Inside here, at that region, is actually our lower esophageal sphincter. And what happens is that inside the stomach, you get all a mixture of acids, and it's going to try to work its way up there, but that sphincter is going to help close it off, along with the help of the diaphragm, which is this muscle. The diaphragm muscle, the one that's going to help you breathe. Now that closes that off so that the acid only can help go out, and it's going to go out the other sphincter. This is the pyloric sphincter. And as it starts to go its way through there, it's eventually going to then enter its way into the first section of the small intestine, which is the duodenum, and eventually going to start up the digestion. Alright, so taking a quick peek at that esophagus, so that's looking at our bolus of food traveling down the esophagus, working its way into that of the stomach, and the stomach is going to mix with the gastric juices and try to work its way down the esophagus, or down the duodenum. Here is just taking a transverse cross-section. Notice that it's not a nice perfect circle. The reason it's not a perfect circle is because it's musculature. We don't want to keep it open because this is actually posterior to the trachea. If this was locked open, we wouldn't be able to get as much air as we need to be able to breathe properly. Take a look at working our way down a little bit further down the alimentary canal. We have our stomach, which is a hollow J-shaped organ. It does have what's called rugae within there. The rugae are folds within inside the stomach. It's going to help expand the stomach to allow to compensate for the food particles that we do get down from the digestion and from our mouth. Now, its job is to propel the food that it does receive, along with mixes the food, breaks it down into smaller and smaller pieces until it gets into that of the small intestine, where it's going to start the main job of absorption. But what it does do, it does start some absorption, very, very small amounts of water, salts, alcohol, and some lipid drugs you're going to see actually starting to be digested and absorbed in the stomach. Now, if you take a quick illustration of the stomach, you notice that the striations are going all sorts of different directions on the stomach. The reason it's doing this is because when the muscles contract, we don't want it to all contract in one way and in another. We want them to mix all over the place. We want to counteract them, act as an agitator, and then that's going to help mix up the food particles. Now, if you take a look interior of the stomach, so here I've done like a coronal cross section of it, you see all of the little folds within there. And those folds are to allow your stomach to expand when you do receive a whole bunch of food. This next slide is going to actually show you a little bit more of that same expansion, but here you're going to end up labeling for your second diagram in your test, coming down from that lower the esophagus into your sphincter. Now, the sphincter is going to enter into the first region of the stomach, that is known as the cardiac region. Region number 2 is the upper region known as the fundic region. So it doesn't actually come directly from the top. Now it's off to the side, so the esophagus is not here. It's actually off to the side a little bit. And then the main region of the stomach is the body, where it does contain all those little folds. And then we finally enter into our lowest region, which is our pyloric region, before it enters into the duodenum. Okay, we're going to start wrapping our way up and just taking a look at one of these last sections of the accessory organs of the stomach, or of the digestive tract, and that being the pancreas. The last thing we're going to talk about is that it does secrete pancreatic juices, and those pancreatic juices, one of the main ones you do know of is insulin. And that insulin is going to help to regulate your blood sugar levels. It does secrete other enzymes that helps regulate fats, proteins, and some nucleic acids. But the main one that you're going to take a look at here is the use of insulin. We'll actually stop there today, and we'll move our way on to section 3 and we'll let you know tomorrow.